All right, thank you so much for attending. This is Alex, and I'm here with Janet Trautwein, the CEO of NAHU. We appreciate you tuning in today. The webinar will be approximately 1 hour. We want to tackle as many topics in a short period of time. So questions posted during the session will be answered at the end. All phones are muted. Okay, so thank you for attending this live webinar on healthcare reform. The timing is between recent Supreme Court ruling and the presidential race. Many of you have similar questions and concerns. In almost 20 years, I've never seen this many changes nor emotions on a topic that affects us all. What used to be a rather boring topic is probably top 3 on the political agenda today, right next to jobs and energy. Employers offering a good healthcare plan has always been historically the foundation of recruitment and retention of great employees. Over 80% of businesses today offer a healthcare plan. As benefits consultants, we are working harder than ever to be part of this solution. We are on time with newsletters, blogs, email notifications, seminars such as these, education on how to maximize benefits, health wellness programs, and technologies, as well as HR 360 and payroll solutions. We know that you're frustrated with markets rapidly changing in New York. The rate increase in recent years have accelerated. Insurers are price controlled, even now more than ever. With MLRs, which Janet will get into, it's getting changing the entire marketplace. So thanks to Janet of NAHU and her organization, we are on this first and send this info to you as soon as possible. Realize that you have an advantage that most small businesses do not. There's been lots of changes in the last couple of years, since 2010, but for New York State, a lot of these law changes haven't really affected us since we've had acts such as preventive care at no cost, no rescissions. If somebody has healthcare benefit, comes down with cancer, they could be denied. We don't have those issues here. Young adult adoption, things such as that have already taken place. But 2014 is really the big year, and now's the time to get a handle on what's to come. At the end of the day, the questions are if the Affordable Care Act attacks the cost curve. We have lots of questions about that. Government cannot afford to run exchanges, nor can they subsidize a lot of the Act's clauses. But we are excited about certain cost curves, such as generics becoming ubiquitous. About 70% of all maintenance drugs will be off patent. We're seeing drugs such as Lipitor that just lost their patent last year, Mevacor coming up, Nexium in a couple of years. So that's going to be a big boost. We're also seeing benefits such as technologies that are being implemented to save money and time, wellness programs, Biggest Loser contest, flu shots, gym reimbursements, health assessment, metrics, a nurse's hotline, chronic management of conditions, which is, a lot of people don't take advantage of a nutritionist. Why pay for someone when you can get that many times through the employer's healthcare plan? So before I hand it off to Janet, just a couple of things. Dan, if you could move the slide, please. Okay. Right now, just real quick, housekeeping. Medicare annual enrollment starts now from the 15th to December 7th. Those of you who have a parent or are turning 65 themselves, if you've waived out of Part D for medications, there's a penalty of 10% per year. Now is an opportunity to get on a plan for January 2013. Also, anyone who's on a plan that is costing them too much money, you can get Medicare Advantage plans that are many times $0. So this happens only once a year. Now is an opportunity. Dan, if you go to the next slide, please. There are several initiatives and advantages that we've taken up recently, which I will leave the slide with you. I'm not going to get into all the details, but there are exciting things that we're using and implementing to make a better outcome for HR and solutions for your small business. Next slide, please. For example, we have the bonus card. A lot of people have actually taken an aggressive tack. By taking out the pharmacy rider, they're saving 20, 25%. This is very aggressive. It's not always recommended, but time and time again, people are turning to such situations where they have to do that. Or they go with a generic-only program. We have a free RX discount card. It's bonusbenefit.com. There's no additional fees for this. We give this to you. There's a link. You can just double-click it, and you get a card. You can print it out and show it at the pharmacy. Average savings are probably about 40%. And without further ado, one more thing. We're talking about reinsurance, health reimbursement accounts, executive supplemental. So many of you already have those plans. Level funding, dependent care FSA. These are all topics that we are talking about when we speak with you at renewal time. This is a great opportunity to find out more information about this. So I'd like to introduce Janet. She's been our compass in choppy waters of healthcare reform. Several employer mandates have been softened because of her. Janet Trautwein is the Chief Executive Officer of the National Association of Health Underwriters in Washington, D.C. NAHU represents more than 100,000 employee benefits professionals involved in the design, sale, implementation, and management of health plans all over the U.S. A frequent speaker on health policy issues, Janet is considered an expert in health insurance markets and health plans of all sizes and frequently testifies before Congress on these issues. Her expertise in issues related to the uninsured, health insurance pools, risks, and reinsurance pooling, health-related tax issues, and both national and global health reform has been recognized throughout the industry. Janet has been published in major newspapers, including Wall Street Journal, New York Times, LA Times, and has appeared on hundreds of radio and television programs around the world. Janet, without further ado, welcome to the webinar, and please take it away. Thank you.
Thanks, Alex. Well, I guess I want to start off not by telling you just the nitty-gritty about what's going to happen with the legislation the first few years, but I want to talk to you a little bit about politics where I live, which is in Washington, D.C., and how that influences what's going to happen. And I know a lot of you may think, well, right, we all know that we have an election coming up in a couple of weeks, but it really goes a lot beyond that. And I want to talk a little bit about what the election means, what the current political dynamic here is in Washington, D.C., as well as in some states, most state capitals around the country, and how that will affect what's really going to happen as we move forward. So from the slide that you can see here, the most important thing I want to say is that, you know, we all hear about how much gridlock there is in Washington, D.C. The fact is that there really is a lot of gridlock, and it's not just something that people like to throw out as a soundbite. In all the many, many years that I've been in Washington, D.C., which is a very long time, I've never seen it as bad as it is today. The partisanship is extremely bitter. You know, Republicans and Democrats are just really not working together at all. But worse than that, even Republicans can't get along with themselves, nor can Democrats get along with themselves. So you have infighting within the Republican Party as well as within the Democrat Party, and certainly they're not going to work with each other. And so I'm hopeful that one of the things, once we get past this election that occurs, is that we'll actually see them settle down and move forward regardless of the election outcome and get some of the work done that absolutely has to be done in the future. Next slide, Dan. So I want to start off with a little bit of a civics lesson, and as we move forward talking about all the things that might happen, I think it's important that we start off here because this time of year it's really easy to get pulled into all of the election rhetoric that's being thrown around. Everybody promises everything, and few really talk too much about how much ability they may actually have as an individual to do what they're promising on their own. And what I mean is, when I talk about all this gridlock we have, it means that that gridlock can't continue if anyone's promises will have any validity whatsoever, including those that are being promised by President Obama. So back to the civics lesson, let's talk about why that is. So whoever the president is, whether President Obama is reelected or whether Governor Romney is elected, whoever the president is holds veto power. But that doesn't mean that they can recreate a law that has already been passed by Congress. It just means that if Congress passes new legislation, they can say that they don't like it and they can veto it. It's very hard to override a presidential veto. Our Constitution does allow for that to be done, but it requires a vote by 2/3 of both the House and the Senate for that to happen, and it's just very, very unusual for that to occur. So the second thing that comes into play that we need to talk about is the makeup of the U.S. House of Representatives. Now, you may have noticed that your member of the House sounds more political maybe than your senator, and maybe you haven't noticed that, but we notice it a lot here. And what it usually means is that with almost everything, that word that's uttered from their mouth sounds like it has to do with some political race or some political issue or some political group that they're at odds with. One of the reasons why it sounds like this is because everyone in the U.S. House is always running for office. They are reelected, every one of them, every 2 years. Right now the House is controlled by Republicans. They have a pretty significant majority, but there still are a lot of Democrats there. And there are a few vacancies from people who are retiring and so forth. Now the Senate, on the other hand, will tell you that they are the more civil body, that they are more deliberate in their action, and deliberate is code word for slow. That's what you should remember about the Senate. They are slow, if nothing else. They take a long time to make up their mind about anything. They are one of the reasons is because they can afford to do that. A Senate term is 6 years, so they're only about 1/3 of the Senate is up for re-election at any given time. The other thing that is very important to remember about the Senate, and I think a lot of people sort of miss this when they're in their basic government classes or their civics classes, the Senate has a lot of parliamentary procedures that assist them in being deliberate in their actions and being slow. And a couple of them, or I'll just name 2 of them. One of them is a filibuster that we've probably all heard of. Maybe you've seen a movie where someone's reading from the phone book on the Senate floor, and the purpose of that is to keep some sort of Senate action from taking place. Another one is a hold that can be put on a bill, and any senator can put one on, and it can be anonymous. They only have to get clearance from their party leader. And these things happen with fair regularity. And unlike the House, where a simple majority either passes or doesn't pass a particular measure, in the Senate, things can pass with a simple majority, but only if it's something non-controversial. If it's anything controversial, or all of these parliamentary procedures require, in order for them to stop, in other words, to get the guy that's standing on the Senate floor reading from the phone book to stop talking so that the measure can move forward, the only thing that will stop that is kind of a supermajority, or 60 votes. So the reality is that anything that's controversial, and today, because of the political environment, pretty much everything is controversial, that means that you need 60 members of the Senate to vote yes. 60 members. It's very, very difficult. And there's a special vote called a cloture vote that allows these votes to move forward once you've removed a filibuster, which takes 60 to get them to stop that. And that means that the Senate can hold up almost anything, and they frequently do. And so what's my point in talking about all of this? Well, regardless of what anyone promises on the campaign trail, they can be thwarted by Congress, or if they're a member of Congress, they can be thwarted by the president. So they may not be able to do, no matter how much they want to, they may not be able to do what they say they're going to do unless someone else cooperates, and that is something over which they may have very little control. Now, next slide, Dan. The other thing that we have to contend with is there are a lot of people who, particularly Republicans, who really, really don't like this legislation. They don't have any interest in making it better or changing parts of it that don't work very well. What they really want is to make it go away, or at least to make certain provisions go away. And so if, in fact, the election does not swing in the favor of the Republicans, they're likely to be, shall we say, uncooperative when it comes to making changes. And you can understand why they would feel that. They don't want to fix something that they don't like, and this is the stance that they take on it. Next slide. So my point in talking about this and starting off with it is pretty important. I think we need to go into looking at what's in this law and what we have to do relative to the law with our eyes wide open. We need to understand that maybe the election will change some things, and maybe it won't. And that even if things are changed over a period of time, it won't happen overnight. And so we better know in the meantime what we need to do to be in compliance to avoid some of the very hefty fines associated with this legislation or some of the other repercussions that could occur. And so that's my point today, is to be extremely practical and say, look, what does this bill say? What do we know about it so far? What's kind of some of the undercurrents going on behind the scenes that could change some of these things? And those are some of the things we'll point out. And I'll focus on a few things in particular, sort of more as an example, kind of as an example of how you should think about things, rather than as an example of every single thing you should think about. And I know that Alex and his crew will follow up with you on things that you need to be aware of, as particularly as they become time sensitive, to make sure that you know what you're supposed to do in certain areas so that you're not fined to the extent that it can be avoided. So that's the point of today's presentation. I hope that you will find it helpful. And let's get started. Next slide, Dan. So the first thing I'm going to talk about is the employer mandate. Now, let's talk about what that means, because a lot of people will tell you that this legislation does not have an employer mandate, and that, in my opinion, is not true. Here's why I think it's not true. The law has a very specific section called the shared responsibility section. And it's 3 parts. The first part has to do with the individual mandate that I know you've all heard so much about. It has to do with the Supreme Court ruling and how the Supreme Court ruled that, in fact, they were going to uphold this provision of the law that requires people to purchase health insurance. And so there are 2 components that are what I would call companion components with that. One of them is the government's responsibility, which is to really provide some assistance for people, particularly those without employer-sponsored coverage who can't afford to pay for coverage on their own, and the government's responsibility to make sure that the market is accessible to people. And then there are a lot of things that have to do with what's the employer's responsibility. And I will tell you that if you're a small employer, there are a number of things that you have to do, but offering coverage, if you're a small employer, may not be one of them. So you may not be required to do it, but there may be many requirements if you do it. And sometimes it's really hard to know whether or not you're considered a small employer. It's not black and white. It's a little bit gray. And so I thought we should take a few minutes to talk about determining whether or not this particular provision of the law even applies to you as an employer right now, because some of you may be small employers for many practical purposes, and you could still find that this part of the law applies to you. So let's go to the next slide. So there's a lot on this slide, and I know that you will have a copy of these afterwards, but one of the key issues relative to this provision is how many full-time employees do you have? Now, that seems like it might be pretty simple, but some of you on the phone may be listening and saying, well, that's not so simple because. So, and we could go on and on about all the reasons why it may not be so simple. So let's try to simplify it a little bit. Let's say that you are an employer, and I'm going to create some examples here, mainly because they're good for illustration purposes. But let's say for a moment that you know for sure that you have 30 full-time employees. Then you've got these other employees. You've got maybe 90 of them that are part-time. They're definitely part-time. They work 10 hours a week. Let's just say, for ease of our math, that they all work 10 hours a week, all of those 90 employees. The law says that you have to, in order to figure out whether this provision of the law applies to you or not, in other words, are you an applicable large employer, is what they call it, how many full-time equivalents do you have? So let's count those part-timers first. By the way, before you panic, there is nothing in the law that requires you to provide coverage to part-time employees. Let's just get that clear right now. But you still have to count them. So let's count them. We have 90 part-time people at 10 hours a week. So that's 900 hours. We're going to count their hours. And then what the law says is that someone is full-time if they work 30 hours a week, not 40, 30. So we take that 900 hours that your part-timers work, we divide that by 30, and we get 30. Now we're going to add those 30 full-time equivalents to the 30 people that you know are full-time, and you have a total of 60. And so even though you technically are an employer with less than 50 full-time employees, this provision of the law applies to you anyway. Again, doesn't mean you have to cover or offer coverage to those 30 part-time or to those 90 part-time people, but it does mean that if you don't offer coverage at all, you could still be subject to a fine. We'll talk a little bit more about that in a moment. So this is why it's important for you not to automatically say, well, I only have this many people or that, because there's just a little bit more to it than that. So now, if you let's assume that we didn't use the example that I just gave you. If you were less than 50 full-time equivalents, then you are not required by the law to offer coverage, and there's no penalty to you if you do not offer coverage. Now, it may be that that applies to you today and you already offer coverage, and there are probably a lot of reasons why you want to consider continuing to offer the coverage that you already offer, or changing it some. We're going to talk about some of the other provisions of what you may or may not be able to do in the future. And I already have some questions that I'm going to address, so I'm going to try to get through some of this as quickly as possible to make sure I address all the questions that you might have. The other thing I want to point out here is that some of you may own more than one business. In fact, you may own multiple small businesses, and they may have separate employer ID numbers. And if you own a significant amount of each of those, a significant percentage of each of those businesses, you can't count them separately. You have to count them all together when determining how many full-time employees you have. Now let's go back to this original example I gave you where you have 30 full-time employees and 30 full-time equivalents for a total of 60. Let's say that you've decided not to offer coverage in the future, and there are some penalties associated with that, which we'll get to in just a moment. What the law also says is that you may subtract off the first 30 full-time employees you have, and you would be not subject to any penalties on those if you decide not to offer coverage. So in this case, even though you're considered a large employer, and even though you had decided not to offer coverage, there would still be no penalty. So it's your 30 full-time employees minus the 30 that you're allowed to subtract. Now, if I'd given you a different example and I'd said that you had 40 full-time employees plus the 30 full-time equivalents, you would subtract off the 30 from the 40 and you'd pay a penalty, which I'll talk about what those are in a moment, on only 10 of them. Next slide, Dan. I want to talk a little bit more about the definition and a couple of things that are a little bit confusing, but I have a feeling from some of the questions I'm looking at that this information might be useful to some of you. So let's talk about those of you who might have some seasonal workers. So when you're counting whether or not you've got these part-time employees, if you have people that are truly seasonal employees, in other words, and seasonal means they work 120 days per year or less for you, 120 or less is the magic number, then you don't even have to count them when you're figuring out the penalties, or even you don't even have to count them in your part-time number. And many of you may be in retail operations or hospitality businesses where you do have seasonal employees that fit this definition. So those people are not even considered. Another thing, though, let's pretend that you're in retail, or maybe you are in home health care, or you've got some business where you've got a lot of turnover, and maybe it's in a particular category of worker that you have. So it would be not by this worker or that worker, but you've got a whole class of workers where you just have a lot of turnover. And in fact, when you hire them, you don't really know whether they're going to be full-time or not, because maybe you hire them during a busy season. Maybe you don't know if they're going to work out because of the turnover that you have. And you don't really know whether to categorize them as full-time or not when you hire them. Even though you might hire them to work full-time initially, maybe what they really are would be considered as a variable hour worker. So what this law has done, and this is a new safe harbor that's just recently been solidified. This is one of the things that Alex was talking about that we've been able to negotiate, because there are a lot of employers in the same category if this applies to you as you are. It's a little bit complicated. I'm going to try to explain it simply, and just to let you know there's a lot more information available. Basically what this says is if you have this category of workers that are variable hours, what you can do is you can pick what's called a 3 to 12-month look-back period, and you can monitor these employees' hours over that period that you select, and the period has to be the same for this whole category of workers, by the way. And let's say that you picked 12 months, because that's what a lot of people seem to be gravitating toward. You monitor them over a 12-month period. If at the end of 12 months, if they still work for you, at the end of 12 months they turned out to be full-time more than they were part-time, meaning 30 hours a week or more, then what you agree to, and by the way, you don't have to cover them retroactively back for the 12 months, you agree for the next 12 months looking forward, you agree to offer them coverage even if they slip into part-time status. And so that's the trade-off for kind of having a free year without having to offer while you're determining what their status is as an employee. And many people that are associated with some of the industries that would benefit from this are very, very pleased by this outcome. And it is far more complicated, unfortunately, than I just described it to you, but that's kind of the gist of it. And it is definitely something that's in your favor if you're in that type of an employer. Next slide. Okay, now let's talk a little bit about exactly what the penalties are. First of all, I'm going to say that there are two penalties. There's penalty A and penalty B, and hopefully neither one would apply to you, but let's talk about what they are. And this only applies, again, to employers where we've determined that this part of the law applies to you because you have 50 or more full-time equivalents. And penalties, let's talk about penalty A. Penalty A is you don't offer coverage at all. And so there's an annual penalty for each full-time employee that you're not covering, which is $2,000 annually. And again, you subtract off the first 30 employees. And this penalty is actually calculated, even though it's payable annually, it's calculated monthly. And why is that? Well, it's calculated monthly because, you know, maybe John Smith only works for you for 4 months, so you end up paying only 4 months of penalty for that person. A number of employers have said, gee, that's less than I'm paying for people for their employee coverage, and we'll have to see whether that penalty remains at $2,000 for a period of time. So that's penalty A, you don't offer coverage at all. And there's a trigger that triggers whether or not you pay this penalty. The trigger is at least one of your employees goes to these new exchanges that are going to be created and qualifies for a subsidy there, or it's called a premium tax credit. And that would almost, if for an employer that doesn't provide coverage, to think that they wouldn't have at least one employee that would go to the exchange is completely an unreasonable assumption. They will, because the tax credits there are fairly rich tax credits, and most employees would want to try to qualify and see if their income qualifies them. So let's talk about penalty B, which is a little bit, we have some good news on penalty B, but it's a little bit trickier. So penalty B says, yes, you offer coverage, but either one of two things or both has occurred. One is, first of all, you have to offer coverage that meets the minimum benefit requirements. And second, the coverage has to be affordable, and the law defines what affordability means. And I will tell you before you panic that the way the law defines what's affordable and the way the new regulation that just came out defines it is a little different. So let's talk about what the law says first, because both apply to a certain extent. So the penalty says is that if you offer coverage and it's either not minimum value or it's not affordable, there's a penalty of $3,000 for every employee for whom it's not affordable based on the standards that they've said for how you measure whether it's affordable or not. And the standard for that is it's considered to be not affordable for an employee if their cost for the premium is more than 9.5% of their family income. And I know you don't know that, and that's where we have this good news. But it's 9.5% based on the cost of self-only coverage, not their whole family, just themselves, for the lowest cost plan that you offer. So it's a little complicated, but that's the way it works. Now, here's the very good thing that's associated with this. We have another new safe harbor because, frankly, the Treasury Department and the IRS and Department of Labor know full well that you don't have any idea what a particular employee's family income is, nor are you allowed to ask them. And so because that is an unreasonable standard to create for an employer, they've created a safe harbor. And the safe harbor is this. If you limit an employee's contribution to 9.5% of their W-2 wages, then you, as the employer, are in a safe harbor and you cannot be penalized this $3,000 for any employee for whom it's unaffordable. Now, the employee still has the right to go to this exchange and say, look, I think this is still not affordable for me because, hey, my family income is less than my W-2 wages because of the number, maybe because of the number of dependents I have, for example. And they can still do that calculation at the exchange to see if the coverage is affordable for this person. And if it is, the employee still retains the right to get this subsidized coverage to the exchange instead of getting your employer coverage. But the employer, because they did what they were supposed to do by limiting the employee's premium contribution, the employer is still protected from this penalty. So you have to work really hard to incur this penalty B, as long as you understand the rules. And it's very important, and I commend you for coming on today to start getting a handle on exactly what those rules will mean for you. Next slide. Now, I want to talk a little bit about this minimum value. And I guess I'll start off saying that the issue on minimum value and what that means to offer a plan of minimum value is not completely defined yet. We've gotten a lot of regulations from all the various federal agencies that are working on these, but we certainly don't have all of them, and we've only gotten a very minimal level of information as regards to what are the minimum plans that have to be offered. And so the first thing I'll tell you is that there are actually two different standards for this. Not that they on purpose want to make it more confusing for you, but unfortunately some of their actions have resulted in that anyway. So first of all, if you're an employer that, and this you've figured out by what we've talked about so far, that this portion of the law does apply to you. But let's say that you have 100 or fewer employees, then there's a standard of the law that will apply to you called the Essential Benefits Standard, and that will govern what the minimum requirement is for coverage that you would need to offer to avoid any of these penalties in terms of the benefit level. So between 50 and 100 employees is different from what 101 or more is. So that's the first thing. So essential benefits is what you'll want to be paying attention to. And you'll be able to purchase coverage, by the way, not just in these exchanges, but also outside in the outside market, the same way that you can today. But of course, some of the rules will be different because there'll be a minimum standard of coverage. And frankly, I doubt in New York that it will look anything in a crazy different way than what you have today in terms of the benefit levels that there are. Second, if you're an employer with 101 or more employees, then you have a standard that's called minimum value, and it's based on a national database of what employers offer. And it may look similar to the essential benefits, but the fact is we don't know yet. And basically what that database does is it computes what the average amount of medical services are that people use for the various kinds of services that are required to be covered under this law. And it calculates what they use based on what plans offer all across the country, what they normally have. And it says as long as your plan pays 60% of what the average person is going to use for these services, and they'll have a database that helps you figure that out and a calculator that helps you figure it out online, then your plan will be considered to meet the minimum standard. And so I would just say as a general rule, I think it will be that most of you probably would meet the minimum standard. We still have some questions about how plans that use accounts like health savings accounts, some types of health reimbursement arrangements. We don't have all the information out yet as to how they are going to value those plans. But there will be this standard, and this is what you'll want to watch for depending on the size of your group, either what the essential benefits are and the minimum there, and what the minimum value is. And just to kind of loop this all back together, remember I started off talking about the shared responsibility requirements. All of this also factors in to what counts as minimum coverage for individuals, because they are allowed to get their coverage either individually or through their employer. And of course, we want to make sure that the coverage qualifies for their portion of the standard as well. So all of these pieces are very much interdependent on each other. All of the market reforms that are coming in, the subsidies to help people pay for coverage if they don't have employer-sponsored coverage, the employer offer of coverage. It's very intertwined together, and this is the concept of it anyway, so that there would be this shared together. And unfortunately, it's not quite as smooth as people probably envisioned, but these are the rules that we have to deal with so far. Next slide. Now, I want to talk about this idea about whether you offer coverage in the future or whether you decide not to. And I want to talk about some of the things that are what I would call kind of intangibles, although some of them actually can be measured. First of all, if you offer coverage today to your employees, there's a reason why you offer that coverage. You probably do it to attract good employees, to keep them, to compete with other employers for the best help. All of us do this because we want to have the best employees to help our businesses run well. Now, if we have a number of employers that say, gee, I don't think I'm going to do this anymore, I will tell you that when Congress passes any legislation, they do what's called a score, and that means that they figure out how much this particular piece of legislation is going to cost the federal government. And when they do that, they make some actuarial assumptions. And when they make those assumptions, I will tell you that they didn't count on very many larger employers dropping coverage, and they figured that kind of a minimal number of small employers would. But if their projections were wrong and a large number more employers dropped coverage than they thought were going to, then all of their estimates for how much this legislation was going to cost the federal government will be wrong. And they'll have to figure out a different way to pay for the subsidies and all of the other things associated with the bill. And that means that you can't count on that $2,000 and $3,000 penalty to necessarily stay the same. It could increase over time. Second, the penalty is non-deductible. Both of them are, so they cannot be deducted as a business expense. Third, When you, as an employer, pay a $2,000 penalty for not offering coverage, this does not follow your employee to the exchange to purchase coverage. It doesn't help them purchase coverage at all. It just sort of goes into the bucket of, along with other taxes and fees that are associated with this bill, to help pay for the overall cost of the bill. Now, I've heard some employers say that, well, gee, if I don't have to pay for health insurance coverage anymore, maybe I will just gross up people's salary to make up for the benefits that they lose. And I will remind you, though, that when you pay benefits as salary, you also increase your employer FICA match, which is 7.65% of every dollar you increase. And whether that's a large amount to you, I guess depends on how large you are as an employer, how many people it applies to. The other thing that I would point out is that if you don't have coverage, if you're not offering coverage for health insurance to your employees, you have to know that some of those people are not going to go and get coverage anywhere, that you kind of give up your control over that and the things that go along with it when they don't have coverage, which usually include them calling in sick more often, or them calling in sick because their children are sick, or them coming to work sick. Something else that people sometimes don't think about is that their workers' compensation costs may go up, particularly for any injuries. And in addition to that, depending on the way your general liability coverage is structured, that could go up as well. A lot of times that is a factor that goes into the overall consideration, particularly if you gross people up. It definitely, many general liability policies are based on overall payroll amounts. Also, you need to think about who your competitors are. Are they likely to continue offering coverage? This may depend on the type of workforce that you have. If you have a workforce that is highly skilled, that is a really significant consideration. If you have a workforce that is largely unskilled, it may not be as much of a big deal for you. And then you might want to think about, well, what happens when a person goes to the exchange? What will they encounter there? Will it be good coverage? Well, I can tell you that they will have some good coverage offerings through the exchange, and of course, they may also want to look outside the exchange for coverage. And some of the people will be eligible for subsidies and some won't. Coverage will be age rated through the exchange, and I'll show you an example of that in just a moment. And I will tell you that not all of your employees would be eligible for a subsidy, and you're not able to say, oh, well, you know, this group of people is all eligible for subsidies, so I'll just let them go over there. But these people over here, well, they make more. I think that I'll continue to offer them and subsidize their coverage. Well, there are new non-discrimination rules that are not going to allow you to do that. So you're either going to offer coverage to your full-time employees or you are not. And if you're not going to be able to pick and choose and continue to cover your key employees, that will not be one of the allowable choices. So it's really important that, I'll talk more about the non-discrimination in just a moment, but this is pretty significant that people may not be able, even with these subsidies and exchanges, to obtain coverage on a favorable enough basis. And the illustration I'll show you in a moment shows this really very specifically. Also, people, even if they are eligible for a subsidy, once they get above about 200% of the poverty level, the subsidy really starts phasing out rapidly. It's very much weighted toward the lower end of the income scale. And again, some employees may not be eligible for subsidies at all, and they're going to be paying for this entirely on their own. These may, in fact, be your key employees, and they may decide to look somewhere else for a job. And so these are very important, not all of them measurable, but things that you want to think about related to that decision. Do I offer coverage or do I not? Because there are as many calculators out there as you can look at that will just do the basic math for you. How much do you pay for your coverage today? How much is the penalty? But there's a whole lot more to it than that. So these are just some of the thought points to think about relative to that subject. Next slide, please. This is the example that I was talking about. This is a slide that illustrates what if you don't offer coverage anymore? What's your employees, what are they likely to encounter when they go to an exchange? And I'd say it's going to be different for different people. So on the left, there's a person age 33 with a family income of $36,000 a year. He has a family of 4. At this income level, with this size family, that makes him 137% of the federal poverty level. And we're assuming here that you're not offering coverage anymore. So the premium for coverage for this person is a little bit over $13,000 a year. This means that he's eligible for a subsidy, a pretty significant one, over $11,000 a year. Excuse me. He still has to pay $1,501 out of his own pocket, which he may or may not be able to do. Excuse me. The person on the right is not so fortunate. This is someone age 57, might be a key employee of yours, makes $95,000 a year, family of 4. Just misses being eligible for any subsidy at all, is at 406% of the federal poverty level. Also, again, has a family of 4. Because this coverage is age-rated, his premium with no tax credit, because he's not eligible for one, is more than $25,000 a year. And I would challenge you as to whether or not this person is likely to have any coverage whatsoever. They're just not going to be able to afford that. That's more than 25% of their income. And so the reality is while this means a whole lot to you as the employer, it also means a lot to the employees who work for you. And these are some of the things, and I'm not in any way downplaying the validity of people who are eligible for these subsidies. It's something that they haven't had before, but it's not a perfect world. And there's a reason why there was such a heavy emphasis in this law on maintaining employer-sponsored coverage. And that's because it's the preferable place for people to be. And so there's a lot of effort going on, both inside the administration and as well as in Congress, even though they're not working together very well, to try to make it more attractive for employers to continue to offer coverage. And they're trying to create these safe harbors, such as a couple of them that I've talked to you about, and there are others that they have in the works, to try to make it better, a better place for you to be as an employer. Next slide, Dan. I'm just going to talk, and go ahead and go to the next one. I'm going to talk very, very briefly about exchanges. There is so much misconception out about exchanges, and so we could do a whole session just on exchanges, so I'm going to really just touch on it here. I will tell you in New York that New York is going to be operating their own exchange, it looks like. We have a lot of stuff that's in the works relative to that, and a lot of progress has been made. Unlike in some states where we have governors saying that they're not going to do anything at all, they think everything is going to change after the election, and a variety of everything in between that. So here's what I can tell you about exchanges. This is a map that it shows what it is going on in each state. But here's the bottom line. Because some of you may have locations in more than one state, and so I wanted you to see this whole 50-state thing so you could kind of get an idea of what's going on. So here's what I can tell you. Every state will have an exchange, and it will either be run by the state, as it will be in New York, or it will be run by the federal government for the state. There is no giant federal exchange. Each state's exchange will stand on its own, and it'll just be run by one entity or the other. And we think that the federal government will start off running a good number of the exchanges across the country, and that would change over time as states decide to run them on their own, because of course they can't customize. There's really no ability to customize when you've got the cookie cutter model of the federal government. So a lot of states will probably choose to go the route that New York has selected and make it more their own, although they will have to operate within the framework that's been set forth in this law. And that's shown on the next slide, Dan. So I know this is a very busy slide here, but I hope that later when you look back through this, you'll find it a good reference piece, which is what my intention was. So what the law requires is that every state have an exchange, and what it actually requires is that every state have 2 exchanges. But all states, and including the federally facilitated exchange, is going to operate under one umbrella, where you'll have one door in for individuals without employer-sponsored coverage, and one door in for small employers to try to shop for coverage there. We don't know or have any expectation that there will be any pricing advantage whatsoever inside the exchange, although some things may be easier to compare or to maybe have different of your employees participating in different coverages. In fact, there will still be a market completely outside of the exchange, although the only place for individuals without employer-sponsored coverage to get this tax credit to help them pay for it is inside the exchange. So I've talked a little bit about some of the other things that you see here. We'll have the state exchanges, or the federally facilitated ones that are operated by the federal government for the states, or we might have a hybrid too. We have a number of states that are looking at sort of partnering with the federal government to use some of their technology for certain things and then operating certain other things on their own. And then the other thing that you're very likely to see are what's called private exchanges, and they're just really starting to be announced, several of them every month, relative to different other ways that coverage will be sort of grouped together so that additional selections may be available that may not have been offered in the past. And what you'll notice that is inside the exchanges, you'll find that coverage, even whether you're in the individual market or a small employer, you'll find coverage that is offered in categories. It'll be 4 categories, but lots of difference within each category. So the first category will be bronze coverage, and that will be the minimum level of coverage, and that will be a benefit that provides 60% of that overall level of what the average person would use. But the plans don't have to be, they're not what I would call standardized. So one plan that is a 60% value may look completely different from another one that's 60% because it just has to be actuarially the same. And then silver will be a 70% plan, gold is 80%, platinum is 90%. Next slide. So I want to get to some of your questions. I thought I would, Alex, is it okay if I just address some of these now? Or would this be a good time, or did you want to do?
Yeah, absolutely. We prepared some questions, and we're getting some rolling in as well. I could pose the questions and take it from the top. Just real quickly, you touched on exchanges, and I just wanted to comment that in New York you have Health Pass. Many of you have already heard about that. We discussed it at renewal time. It sounds good because you give the options to the employees. It's a cafeteria plan, and they're empowered to select their own plan. But there's a lot of questions that arise, such as which networks, what's the quality of the network that they're selecting. Choice is important, but sometimes the quality of choice is questionable, and we're not sure how the exchange is going to play out. Janet, just a question. Is there any stipulation on the network quality or the size of the network that has to be issued to be participating in an exchange?
Well, that's very interesting. For the first thing I will say in that regard is that most states have quality standards that are not necessarily overruled by this law. So if the particular aspect of quality is addressed by state law but not addressed in the federal law, then the state law will still prevail, whatever it is. Having said that, there are separate standards being developed that we haven't seen yet regarding the quality of qualified health plans offered in the exchanges. So yes, there will be. The short answer to the question is that yes, there will be quality standards. Whether or not is network adequacy, I think that will be a standard, but I think a lot of them will also look to network adequacy laws that have already been passed at the state level as well. So they'll be sort of combining. They're not trying to completely overthrow state reform. I guess that's the point I want to make here. So when you think about some of these things, you think, is there a state law already that addresses that? Does that state law conflict with the federal law? If it doesn't, then you're still going to have that state law.
Okay. Keeping with the exchanges, there's two types of exchanges. Just to reiterate, there's an individual exchange, and then there's the shop exchange. HealthPass is an example of an employer-based shop exchange. Do you know if the age rating that you mentioned applies to both exchanges or just the individual exchange?
It applies to both.
So if someone is between the ages of, let's say, 21 and 41, they'll have one rate, et cetera, correct?
Right. What the modified community rate says this, and this is a big question for New York, so let me make sure you understand what the rating structure is. The rating structure says that the rate for the oldest person who might purchase coverage, either in a part of a group or as an individual, cannot be any more than 3 times the rate for the youngest person. Now, that might purchase coverage. I'll tell you that rate is very, very strict compared to what most states have, but in New York, it's just the opposite. The rate that you have in New York is much more strict than that. And so there's this big question about whether New York will retain the more strict rating schedule that they have or adopt this one. And we don't know that yet. If New York keeps their stricter rating schedule, there are going to be some associated charges with that, and we're not quite sure where the state would get the money to pay for that. So there's a good chance that this 3-to-1 will apply in New York, and if it does, then yes, it's in the individual as well as the small employer exchange, the shop exchange.
Yeah, I just want to comment. In New York State, as you all know, the group marketplace is community rated, meaning it's one fixed price. It doesn't matter if you're 25 or 65, it's one fixed price. The fallout is that on the individual direct pay, the non-group side, it's extremely expensive. A typical HMO is about $1,200 a month for a single. So I think what Janet is explaining is with the exchanges, the individual marketplace is expected to go down the pricing, but they're still resistant into having age banding as this will happen in most states in order to make this affordable for everyone. So it's definitely worth looking at. Just another question, federal exchanges, would that cross lines? So example, like New Jersey, which has not set up anything so far that I know of, and they're going to adopt a federal exchange, would it be a universal exchange, one type of level for everyone?
No. Because each state will still have to take into consideration what's going on in that state. And let me give you an example of that. So each state, as a part of that, when we talk about what this essential benefit standard will be, each state is selecting their own benchmark based on a set of choices they've been given. So first of all, no state's minimum standard will look exactly like any other state's minimum standard. So even if the federal government is operating New Jersey, it will still be the New Jersey exchange operated by the federal government. Same way if it's Pennsylvania or any of the other surrounding states, they'll each be their own, regardless of if it's a state or the federal government operating it for them.
So this comes to my next question. I understand the exchanges are supposed to get seed money for the first 2 years, but starting 2016, I believe, they're supposed to be self-sufficient at that point?
Yeah, it's 15 actually.
Oh, sorry.
It's 15. It's even worse.
So hopefully there's money there to extend it, because I don't see a lot of local states being able to afford to run their own exchange. So what's the advantage of a New York State running their own exchange if they have to probably incur extra costs, and in a state like New Jersey, they can rely on the federal exchange?
Okay, so that's a great question, because here's the deal. It doesn't matter who's operating the exchange. In 2015, the exchange has to stand on its own, and all exchanges could be paid for really one of 3 basic ways. So first of all, you could have a state appropriation, and so that the state could be, paying it out of some out of their general funds, and a certain amount was segregated for this purpose. I doubt that's what New York or any other state will be doing in order to pay for theirs. What most are looking at is one of two main ways. First, definitely if the state is running their own, they're going to use assessments. And New York has a history of doing this in some other aspects of the law as well as user fees. But I've seen assessments on various New York projects before, and that's what I would anticipate. If the federal government is operating it for a state, and when an assessment occurs, what happens is they assess a certain percentage, usually on all plans that operate in the state, so they kind of spread the grief over a large number of participants that operate in the state of New York, for example, so that there wouldn't be too much on any one person. When the federal government is operating for a state, they do not have that broad assessment authority. They can only control what's inside the exchange, right? What's offered in the exchange. So what they're going to do, and by the way, some states are doing this too, that are running their own, is they're planning to add user fees, and that's what would pay for the operations of the exchange. And this is user fees have been used in Massachusetts, for example. So some states do this on their own. You know, we've probably heard of the Massachusetts Connector,
right?
And they've used that mechanism there. But the reason why a state wants to do their own is because there are a lot of things that are going to be kind of manipulated through the exchange. People will be qualified for Medicaid there. They'll be qualified for S-CHIP. They'll be in a state. Most states feel like they have a lot more control over the way their exchange is structured if they don't have to use the federal government's model. And even though they have to operate within these set of parameters, it's not quite as strict.
So it's not that clear yet whether the model of New Jersey of using the federal exchange or using the New York model is better or worse yet, or you suspect probably the New York model is going to add to, since there's assessments, there's going to probably add to the costs.
I don't know if one will be the other, because look, it's going to be an assessment or it's going to be a user fee, but it's not going to be free. So the advantage of an assessment is that you can assess plans outside the exchange as well as those in.
Okay,
and keeping the authority to do that.
And you touched on Massachusetts. So from what I'm reading, the Massachusetts model, most of the state is insured, which has been a success story. But how are they bending the cost curve? How's that working out?
We haven't noticed any bending of the cost curve. So that's just an observation there.
Supposedly, when you have everyone insured, it spreads the risk, and the hospital hits and expenses are reduced, and supposedly everyone is under the same umbrella. That's supposed to reduce costs. But from articles in the New York Times and other sources, we've read that utilization actually goes up as well. So there is actually
may or may not. If providers are compensated based on quantity of services, and you're only increasing the number of people that are consuming a quantity of services, then what happens with the cost just goes up, right?
Right.
But if if some of the other aspects of the legislation that currently are limited to really demonstration projects within the Medicare program, if they were expanded, some of this doesn't mean the law has to require this. This means that it could be a private sector initiative as well. But if we see some other things happening, like you mentioned some of the drugs going off patent when we started off, but there are other things you can do bundled purchasing, you can do value-based incentives and things like that, quality initiatives. There are a lot of things that could be done to bend the cost curve. We just don't see too many of them in this bill.
Okay, Janet, we're running across shortage of time, and I only have time for 2 more questions. But the other questions that we didn't get to, we'll try to answer in a subsequent email for everyone attended, as well as a recording of the event. Next 2 questions I have are: we have a staffing agency with 100 employees that are paid W-2. They're temp agencies. 10 managers are getting paid, are getting covered under the small business healthcare plan, but the others are seasonals. They're part-timers. They're not working 40 hours. With the formula and the full-time eligible equivalent formula, I know I'm going to be counted as an over 50 case, and I'll likely will have to pay a penalty.
Maybe not.
Are there safe harbors that I can establish to avoid penalties?
Yeah, okay. May not have a penalty. So the 10 people that you know are full-time, sounds like you're already covering them. Anyone that is less than 30 hours a week, which I will point out to you that you control the number of hours they work, and you are allowed to control that to make sure they're less than 30 hours a week. And so that's one thing that people are doing to make sure, because there's never a penalty paid on someone that's less than 30 hours a week, even though you have to count them to see if you qualify as a larger employer. You don't ever have to cover them. Your seasonal people, if your seasonal people are truly 120 days a year or less, you also do not have to count them. And then in addition to that, you can use this look back that I described, I think it was 4 or 5 slides in, to say, okay, in addition to these two, I know I've pulled out my part-timers, I know I've pulled out my seasonal, and then I have these other variable hour workers that I don't really know if they're full or part-time. You could look at them over, let's say, a 1-year period to determine whether they would be full-time during that period. So I think that, in fact, relative to the negotiation of this particular safe harbor on that look-back period, staffing companies were one of the main negotiators at the table in the coalition that we're a part of, negotiating that provision. And I think a lot of staffing companies will turn out to be okay because of that provision being in there.
Okay, but if there are 2 employees working, let's say, 20 hours or less than 30, 20 and 20, clearly that's probably it's at least one full-timer right there, right?
No, you don't. Well, it is, but it's only an equivalent. And so if you have 2 people working 20 each, you don't ever pay a penalty on them. You just use them to count whether or not you even have to worry about this provision of the law. But if each one only works 20 hours, you are never required to offer coverage to them, and you will never pay a penalty for them.
Okay. Thank you so much. This is the most common situation that you probably get asked, and this is probably the most common situation for small businesses, for doctors, groups, construction companies, restaurant businesses. I have 30 employees. 5 people are managers. We give them health insurance. Everyone else, they're working 40 hours, but they're hourlies. We consider them staff. We don't offer a health care plan for them. I'm under 50 employees, so I'm not going to pay a penalty, but how's that going to work with participation requirements? Are there any fallouts on that?
So the answer is you might have a problem. You probably do have a problem. So here's the issue. If you know that your total full-time equivalents, including all the people that work for you, because remember, you've got to, when you're counting your full-time equivalents, you do count the part-timers, even though you don't have to offer them coverage. Now, you told me that the total full-time people, including those you cover, those you don't, is less than 50. So let's go with that example. So there's another provision of the law that we just touched on, and we did not go into any detail on it, and that has to do with the non-discrimination provisions. And there is a law that uses Section 105H of the Internal Revenue Code that has been in the past only applicable to very large groups that are self-funded. And at some point, when it's no longer delayed, which it currently is, it will be applicable to smaller groups such as yours. And basically it says that you can't discriminate between those 4 management people and all the other people that are full-time. You have to offer them all coverage. And there is a test to determine whether or not that coverage is offered to everyone. And there's also currently a test that tests whether or not disproportionately a larger number of more highly compensated people actually took the coverage as opposed to the less highly compensated staff that you have. Now, what we are working with, we are actually working on another safe harbor right now relative to this, because it's for an employer of your size, it's a very unreasonable test. It may work just fine with a large employer that has more employees to spread the test over, but it's almost impossible to comply appropriately for an employer in your size category. So I'm hopeful that we will be successful with that, and I'm hearing from the Treasury Department and the Department of Labor and so forth that they want to find a reasonable solution so that you can continue to cover the people that you cover today. But if I only go by what's written in the law right now and the regulation is delayed, then I would say that you will have a problem in 2014 unless the regulation creates another safe harbor, which we're hopeful that it will. Does that answer the question, Alex?
It does. But you know what? I do this for a living, and it's really a lot of information. I can only imagine how everyone is looking at this. But that definitely answers the question. Again, I'm going to record this, and we'll be able to answer questions that we didn't get to. There's one more question I want to squeeze in, and that's the last one. Here we go. If an employer offers an increase in salary equivalent to single-person coverage, what if any are the W-2 reporting requirements? This would be a small employer, less than 30 full-time equivalents.
So there's no penalty for you for doing that, first of all. In fact, if you're a small employer, there's no penalty to do it other than you do have to report it as wages. So right now, if you offer benefits, of course, it's not taxable to the employee as compensation, and nor do you pay any associated taxes as the employer, whether it's, all the things an employer pays based on the cost of their payroll, whether it's workers' comp or the FICA match or your general liability cost or whatever, all that goes up when you have a higher wage base. But perhaps you have 30 employees and that is the decision you choose to make. You're not going to have any legal gotcha or anything like that, other than you're going to pay more tax, and so are your employees.
Okay. Well, this concludes today's session. I know we went over time, and I really want to thank Dan and yourself for doing this for us. It's definitely a lot to consume, and I think there's probably a lot more to come. So let's stay connected. Let's all be part of this conversation. If you are able to, please let your voice heard as a small business owner, as a New Yorker with the local legislators. They do actually listen, believe it or not. So let your voice be heard. Record this slide will be recorded and will be sent to participants. Again, our thanks for tuning in today. It is our hope that you have a greater understanding of the Affordable Care Act. We recognize that this is not a one-year journey and hope we can be part of the solution. Our success and independence comes from loyal, long-time clients such as yourself. And in an age of big box stores, international competition, hedge funds, private equity, it is more crucial than ever to let our voices be heard and work together as small businesses. Please email us any suggestions or anything we did not touch on. If you're a local Rotary, association, chamber, benefit, etc., if they would like to hear more about this, we do public speaking on this as well. Unfortunately, Janet will not be there. She's got lots of things, and might I add, she really does this for larger groups. She speaks in Congress. I think she just flew to AFLAC and did a presentation. So this is very unusual, and I do really appreciate her extension of this. So stay tuned for solutions on wellness, payroll solutions, HR, professional employee organizations. We are coming out with innovative products constantly. And please don't keep us a secret. This is how we were able to stay in business through great loyal clients such as yourself. Thank you all. Have a wonderful day.
Thanks, Alex.
Bye, guys.